So in Liverpool, we, at a very early stage, pivoted our local healthcare partnerships. So that's all the NHS trusts on our patch, and there are a lot in Liverpool. We've quite a fragmented NHS offer with what was 2 acute adult trusts and is now happily 1, but 6 specialist trusts, so a huge number of trusts who belong to our healthcare partnership. We pivoted all of those trusts and the 2 main HEIs who are active in infectious diseases research, that's ourselves and the Liverpool Tropical School of Medicine, into a new sort of goal command type structure, which we call Liverpool Stop COVID, which I actually chair. And we created this incredibly flexible, responsive system with a gold, silver and bronze command with operational pieces on the ground, and gold command overseeing the governance. And we did that mainly mainly because we had to. We in Liverpool lack significant NIHR infrastructure. We don't have a biomedical research centre or an academic health science centre. So we, in the space of a week, tried to recreate that infrastructure and the governance and framework that would have given us. What it actually allowed us to do, and what we are very keen to retain if peacetime comes again, is actually, unlike what happened in London and Hugh's experiences, we were actually able to retain our research capacity within the NHS. So the majority, not all, but the majority of our NHS partners have actually managed to not pull back research nurses to frontline care, because we had some warning and because we flagged that the fourth pillar of how we were going to get out of this mess was through high quality research. And working with our chief execs, because they were well cited on what was coming down the track and what the need was, they've managed to retain that research capacity. It's also given us an amazing agility to do things that actually are well outside of my remit. So I'm a clinical academic. My job is to make sure that we do, fantastic education and research. I never for 1 minute imagined that I would turn into a small engineering manufacturing plant making PPE. But within the first week, when we got our Department of Engineering actually saw some code to 3D print elements of PPE, including full face visors, we went into wholesale production of PPE for our NHS partners. So we learned that we could do things as an ecosystem that we would never have imagined even attempting, during the pre-COVID era. So that creativity, that flexibility, that cohesiveness, the structure that we've created out of necessity that we didn't have before this, that's something that I am desperate to retain in the new normal, whatever that may look like, because it's given us a newfound cohesiveness and a closeness and an ability of a fragmented health ecosystem to respond as one. And it's also, out of adversity comes great things. It's made us creative, it's made us flexible, it's made us imaginative. And it's made us passionate about what we're doing on our patch. As I said before, we're all in it together, but we really do feel that in Liverpool, we're all in it together as a city.